Okay, I think as you can see, a little bit different today, new rules in the Capitol with the legislature starting to come back, at least on part-time and temporary and limited basis. We have imposed a new mask rule on the executive branch that anytime there are others in the building besides the media who are here on a regular basis or agency staff, that we will be wearing masks in the public areas. So today, what I want to do before I hand it off to Secretary Smuda is I want to talk about George Bernard Robert, the Lansing Correctional Officer who died of COVID-19 recently. George was actually known as Bernie. He worked at Lansing for 36 years. He was born in 1958 in Landstuhl, Germany. Interestingly, I was actually in Germany in 1958. My father was stationed in Bad Kissingen. I'm assuming that Bernie's dad was stationed at Landstuhl. And the same year that Bernie was born, my brother Paul was born just about 200 miles away from where Bernie was born. During the 36 years that Bernie worked at Lansing, he became a beloved and a well-respected member of that staff. He was always known to do more than his fair share and never to leave anything undone for the next shift to have to do. So they will miss him greatly, as will his family. He leaves his wife Susan, his wife of 37 years, and he leaves his daughter Rachel. Bernie wasn't just a correctional officer, however, or a husband and father. He also was a bit of a Renaissance man. When I looked at the kinds of things he spent his spare time doing, I was amazed. This is a man who went from working on cars to tinkering in the garden to cross stitch and a variety of other things. But probably his proudest achievement were the two 300-point bowling games, perfect bowling games that he bowled in his lifetime. I think his wife Susan, whom I tried to call today, had to leave a voicemail. I was not able to get through. I think she said that though that the last time that she actually spoke to Bernie was on May 2nd, and her final words to him were, "You hang in there, fight this, so that you can be at your daughter Rachel's wedding next year." I am so very sorry that won't happen, and I send my deepest sympathies to both his wife and to his daughter. I think you know that we also lost another correctional officer from Lansing. We're still working with that family. I have talked with his daughter, but we're not ready we're not in position right now to tell you the name, but we will do that shortly. And with that, I'm going to hand the microphone over to Secretary of Corrections, Jeff Smuda.
Thank you, Governor. This is an extremely difficult time for the Kansas Department of Corrections and our staff. Our entire organization is mourning the loss of two dedicated and respected members of our corrections family. Together, they provided over 5 decades of service to the people of Kansas and were valued members of the Lansing Correctional Facility team. Our thoughts and prayers are with their families. In leading the agency for the better part of a year, I have seen firsthand the dedication and commitment that our staff have to each other and to the rehabilitation and care of the residents in all of our facilities, as well as those who serve through parole and juvenile services. Last week was National Correctional Officers and Employees Week, and I want to take just a moment here to recognize the more than 3,000 Kansas Department of Corrections team members who routinely place themselves in harm's way in normal circumstances, and even more so during this pandemic. This virus does not discriminate and has touched so many of us in our lives personally. Our loss this week of 2 from our agency family is evidence of that. We are committed to doing everything we can to ensure the health and safety of both our employees and those in our custody. Toward that end, as we prepared for and implemented practices in response to the COVID-19 pandemic, our collaboration with Kansas Department of Health and Environment has been constant. KDHE has been with us every step of the way, and I appreciate Dr. Norman very much and his team's contributions to help KDOC. Even as we've been confronted with an inadequate supply chain for many goods and services needed to adequately respond to the virus, we've taken many steps to help protect our employees and our residents. We have followed KDHE and CDC guidelines for staff personal protective equipment. As N95 and surgical masks are difficult to obtain, we provided masks who were in a position to quickly implement production and meet our own needs for masks, something since we have expanded to other state agencies and to local jails. We implemented initially a passive screening process into our facilities, and then later an active screening process. Those screening processes determine an employee's eligibility to come inside the facility and work on any given day. We suspended visiting and volunteer activities in all of our facilities in early April. At this stage of our response, we're requiring staff at facilities that house positive residents wear masks at all times. Those facilities are Lansing Correctional Facility, Topeka Correctional Facility, and the Wichita Work Release Facility. Other facilities can begin the required use of masks prior to a positive resident at the discretion of the warden. We continue to adjust practices and strategies to be consistent with what the science is telling us about the virus and from lessons learned by corrections agencies throughout the country. I'll now hand off to Dr. Norman from KDHE.
Good afternoon. May 13th. Today's case numbers are that in the state of Kansas we have 7,468 positive cases, which is an increase in 352 since yesterday. We have 50,160 negatives, with 164 deaths to date, an increase of 6 from yesterday. Kansas has had a total of 88 outbreaks. 40 are considered closed. 48 are active. These outbreaks account for 3,500 cases and 116 deaths. The cluster breakdown is as follows. 36 occurred in private companies with 329 cases and 4 deaths. 19 of those outbreaks are closed. 26 long-term care facilities, 9 of which are closed. That is, the outbreaks are over. 593 cases, including 95 deaths. 9 churches or other gatherings. Of those 9 outbreaks, 8 are considered closed. 114 cases and 9 deaths. Meatpacking, which now there's 8, includes 1 Missouri plant that's close to the state line that is impacting Kansas residents as well. 1,536 cases and 4 deaths. 3 group living situations, 2 of which are closed now. That is, the outbreak is over. 41 cases, no deaths. 3 correctional facilities, as Secretary Zamuda talked about, in Lansing, with smaller problems in the Wichita Work Release and Grossman Center. 864 cases, 4 deaths. And 3 outbreaks that have been associated with healthcare facilities. 2 of those outbreaks are considered completed, meaning closed. 22 cases, no deaths. Travel-related quarantine, some changes. Yesterday, KDHE added 1 state, Maryland, to our travel quarantine list, but removed 2 others, including Colorado and Louisiana. Obviously, the removing of the Colorado makes it significantly easier for people traveling from Colorado to the state of Kansas. For a comprehensive list of those in Kansas needing to quarantine for 14 days in terms of travel related, please visit our website. I did want to pass along some information that late yesterday we received 10 cases of remdesivir. Remdesivir is the antiviral that has an EUA, emergency use authorization from the FDA to use in COVID-19 affected people, typically used for those that are in intensive care units, on ventilators, or have high oxygen requirement needs. We've received 10 cases in the state of Kansas. Those have either been distributed today already or will be distributed today before the nightfall. And we're sprinkling those around to obviously the places where patients are that would benefit from this. I will caution, a cautionary note is that remdesivir hasn't gone through all the what we consider the double-blind randomized controlled trials to document its efficacy. But it has been found in Europe particularly, and in some early anecdotal and cases in the United States, to be of benefit. So we're hoping that this is something that we can add to our armamentarium in the state of Kansas. The shipment of 10 cases represents the first shipment we expect, and on a call I had yesterday with the FDA and the company, we expect that this will be the first of perhaps 4 shipments. The second shipment should occur later this week or next week, and hopefully it will be a larger shipment. One case treats about 5 patients, so you can see that 10 cases treating about 50 patients will not be sufficient for what we expect that the future holds for us, but it's a start. It also depends if it's mostly adults, then it obviously requires higher dosages than pediatric patients, and that it can be used either in 5-day or 10-day courses. We're recommending, and most organizations are recommending, a 5-day course. It seems like the maximum benefit is achieved in 5 days anyway. So that's the end of my prepared remarks. I'm going to turn over to Secretary Garcia of Labor.
Thank you, Dr. Norman. And today I would like to share with you 3 pieces of very important information, including our unemployment programs and numbers, also call center statistics, and our workers' comp regulation legislation in progress, all to make sure we are helping our Kansas workers receive their money as soon as possible. First and foremost, I would like to also offer my condolences to the family and friends and coworkers of the corrections officers who lost their lives to COVID-19. My heart goes out to all of you and to all of the workers on the front lines. Governor Kelly directed the Kansas Department of Labor to explore workers' compensation to help Kansans who have put their health and lives on the line during COVID-19 pandemic. She asked that we research, write, and submit a temporary regulation and legislation to provide protections for law enforcement, firefighters, emergency medical service providers, healthcare workers, and essential workers during this pandemic. The regulation and proposed legislation would create a presumption that first responders and healthcare workers who contract COVID-19 contracted the disease arising out of and in the course of their employment. In response, we have submitted 2 temporary regulations to the Kansas Attorney General's office. The Attorney General has denied the first regulation. We are still awaiting a response on the second regulation. If the regulation is approved or the legislation becomes law, Kansas would join other states like our neighboring state of Missouri in ensuring the safety of our frontline workers, so they know while they are risking their lives to take care of our fellow Kansans, we are taking care of them. The first regulation was denied on the basis that it needs to be a legislative action. With a much abbreviated wrap up to the legislative session, we are exploring all options right now to serve our Kansas workers and to hope to partner with the Attorney General or the legislature on this essential endeavor. We have been moved by many heartfelt messages that we have received, people pleading for this protection, including from the Kansas State Troopers Association. I thank all of you for your service, and by the nature of your work, Our frontline workers are already heroes, but what they should also not be martyrs. We will continue to find ways to ensure your health and safety like you do for ours. And thank you for having our backs, and we will have yours. Now, shifting to recent news, I am pleased to announce the Kansas Department of Labor began accepting applications for PUA, the Pandemic Unemployment Assistance Program, yesterday morning on our new part of our website, www.pua.getkansasbenefits.gov. As you know, PUA is part of the CARES Act and runs from January 27th through the end of this year, December 26th. Our IT division built an entirely new system for this new program for individuals previously not covered by traditional employment insurance benefits. This includes 5 categories. First, self-unemployed. Second, independent contractors, including gig workers such as Uber and Lyft drivers. Third, employees of religious organizations. Fourth, those who lack sufficient work history, or also the last is those who have exhausted benefits or have been disqualified for state benefits, all being impacted directly by COVID-19. And as of noon today, we have received 14,626 initial PUA applications and 29,557 weekly PUA claims. I'm excited to take another step forward in providing vital benefits to our hardworking Kansans. KDOL expects to begin paying PUA benefits by May 25th, with continued enhancements made to the program as the development progresses, and KDOL receives further guidance from the U.S. Department of Labor. And if approved for PUA, claimants should know that they will receive their $600 additional payments on top of that. The FPEC runs from March 29th until July 25th. So when you receive your weekly unemployment benefits, the FPEC $600 back payments will be on top of that as well and be completed. Even if you go back to work, because that is a question we keep receiving, you will be paid the back payments. You should know a very important factor that's happened is our bank had a daily withdrawal cap of $75 million on our account, which is why we had to do the immediate approach. The good news is we are working with the bank to remove this cap, and we'll have more updates for you next week. Now, for an updated national April report released last Thursday, it revealed a national unemployment rate increase at 10.3 percent points to 14.7%. This magnitude is on par with the Great Depression. It is occurring at a much greater speed, and it took the Great Depression about 2.5 years to see the employment declines that we are seeing in just 6 weeks. Kansas joins states across the country that grapple with confronting the capacity challenges that we are in now. I want to share with you the numbers from March 15th to May 9th. We received 236,412 total initial claims. And last week, we had about 115,536 continued weekly claims, with about over 93 individuals receiving benefit payments. And so far, payments have totaled roughly about $320 million, including the FPEC $600 payments, being over about $136 million. This amount will continue to increase as we begin to pay the retroactive additional $600 payments to individuals. These dramatic claims numbers represent hard-working Kansans filing online and on the phone. And we are working hard to serve as many Kansans as we can every day, and we continue to build capacity so that we can do more and more. We are still receiving about 150,000 to 250,000 calls a day, and there's no system that can easily handle these volumes. We are mitigating by adding capacity wherever we can and adding functionality on the frontline interface. So for now, we are still encouraging individuals to please use our website whenever possible and file only the claims designated by their last names on our website. And our continued focus is to do the hard work continually and incrementally add skilled and trained staff to our contact center operations, both for the short term and long term. And we need to keep increasing our number of fully trained staff that cannot answer just merely the phone, but also provide the necessary and critical claim-specific work to assist our fellow working Kansans who have been impacted by this crisis. And you should know, for the future, our plans will be to pick up for our agency plans to modernize our UI system and look forward to working with both the federal and state government to make this happen. One thing that is very clear is that states that have not invested in the digital infrastructure that supports critical government functions should be looking at what is happening in our unemployment insurance system as a North Star. And despite these unprecedented challenges, I am thankful for the ingenuity and dedication of my staff in combination with the swift actions and partnership of the governor and her office and the state legislature. The legislature's initial action of extending unemployment under benefit weeks and suspending the waiting week in combination with the governor's actions, like her emergency declaration, have been crucial for hardworking Kansans. These actions have allowed my agency to receive vital funding, federal funding, and implement essential operations, like allowing us to reassign staff from other agencies and divisions to assist with the immense volume of unemployment. Without these actions, I am confident we would be in a worse position. So I want to thank the Kansas legislature for supporting the emergency declaration in order for us to accept these funds for our hardworking Kansans. We realize that this will not be over this month, and we continue to receive updated guidance from the U.S. Department of Labor on a weekly basis. We will need flexibility to continue working with the federal government for the rest of this year. Congress may pass further legislation to address continuing or new needs for employers and employees, so we could face significant challenges or roadblocks to receiving further funding if the Kansas legislature is not in session. So I ask for the partnership with the legislature and the governor in the coming weeks in order to serve our hardworking Kansans. And now I will pass it back to the governor.
All right, questions?
Governor, are you satisfied with your administration's response to the coronavirus outbreak at Lansing, given the mounting death toll?
I am really sorry that we are starting to experience deaths within our staffing ranks in our correctional facilities. But yes, I am confident, Jonathan, that our Department of Corrections, Secretary Smuda and his folks have done all that they can. Not that they will not continue to try to improve the conditions there, but we're talking about a situation where you have 1,700 men, in one facility, not to mention the staff, and you've got to move these folks around from living quarters to cafeteria services to showers. It is not easy, and it is probably one of the most difficult environments in which to mitigate the spread.
Secretary Smuda, you listed a number of measures that you're taking. I wonder if you could clarify, are any of those new measures following the deaths of staffers? I mean, are there additional measures that are being taken because of those two deaths?
Those are not new measures. They're ongoing. They've been in place for some time, and we will continue to review our practices and improve those wherever and whenever possible.
Okay. And will there be any more releases of prisoners? Have more prisoners been released?
We had an initial release, but we're not contemplating additional releases at this point.
Can you tell us how many inmates are currently hospitalized? And staff, if you have that information?
The last I checked, I believe we have 4 of our population that were hospitalized, and I believe we have 2 other staff that I'm aware of that are hospitalized.
Sir, and also the masks, you talked about producing the masks. You're speaking about fabric face masks, right? Not surgical.
That's correct.
Okay. And can anything be done to get more professional grade, protective gear into the prisons for the staff of the prisoners?
Yeah, I believe emergency management for the state is working on getting more masks, and then we get a share of those to be used when staff are having close personal contact, like our medical providers and staff that have to be in the room for that. So we get those from the emergency management folks.
Governor, there was a FEMA document that identified the Kansas City area as I'm going to mess up the terminology,
Hotspot.
but a place of interest, and I think Kansas was also identified as having a growing number of cases. Were you aware of that designation, and does that concern you to be identified as such?
Well, I did see that on the map, and I looked, and it comes on over into Kansas. I think the bulk of it, though, really was on the Missouri side. Are we concerned about any of these spikes and potential hotspots? Absolutely. That's why we're working very closely with our local public health departments. They're fully aware of what's going on, and we're doing everything we can to get them the tools they need to both prevent further spread, but also to deal with what they've got.
And just to follow on that, when do you plan to make a decision and announce your decision on whether we're moving to phase 2?
We expect to have something out on that tomorrow, and we'll probably deal with that issue at the Friday press conference.
And Governor, are there other contingency plans in place if staffing levels decrease in the prisons because of more staff being, testing positive for COVID-19?
I think I'm going to pass that on over to the Secretary of Corrections.
Yeah, we're going to begin testing all of our staff tomorrow. We've tested a certain number through the normal course of things, but we're going to begin mass testing of our staff. It begins tomorrow and carries on into next week. If we see a number of staff that have to be away from the facility because they've tested positive or they have the symptoms, we have the means to bring in some staff from other facilities and then go to a much smaller staffing model, maybe more of a restricted movement type situation than we have today.
When you said testing the staff, do you mean across facilities, or you're referring specifically to one facility?
Good question. We're going to test the staff at Wichita Work Release, where we've seen some more positive cases there, and then we're going to test the staff at the Lansing Correctional Facility, where we have a greater outbreak.
Secretary Garcia, I'm not sure if you've heard this, I've brought it up a couple of times, that we're getting a lot of people saying when they call, they aren't even able to stay on hold. They get kicked off and say, call back later, and so they're just hitting redial. Have you heard that? Is that an issue?
Yes, we have heard of people calling and then the hanging up. And one of the things is it speaks to the high call volume. And the best I can say right now is continued calling. We are, just in the last few days, this whole week, I've been talking about, again, building more capacity with our own IVR system, our own phone system internally. And so that is something that we'll hopefully have by the end of this week, and it will be continued capacity.
Secretary Norman, why have the Kansas City area nursing homes led to lots of cases in many fatalities, but Southwest Kansas's huge cluster of cases related to packing plants have not led to many deaths?
Yeah, good question. If I may paraphrase. So the outbreaks in the Kansas City metro area in nursing homes have a higher death rate than the Southwest Kansas in the meatpacking. Yes, good question. And by the way, that is true. The people in the meatpacking plants are younger and healthier. One of the things we're finding a lot of clarity about is that people that have concomitant medical conditions are much more likely to succumb to the illness. And that's true, by the way, in terms of the people in the corrections facilities. Also, that anybody that has underlying cardiac or respiratory, renal disease are much more likely. Even one confounding condition makes a person much more likely to have either severe complications or succumb to the illness.
Secretary Norman, have you heard about businesses that are asking people to get a negative result on a COVID-19 test before coming back to work, like in Shawnee County?
Yes.
So, what do we make of that?
Yes, the question is, should it be required that somebody come back with a negative nasopharyngeal PCR test before allowing to come back to work? And the answer to that is it is being required, and I think it's a bad idea, quite honestly. And we hear about it every single day. And my justification for that, and it shows itself in many different ways. For example, when a person is in the hospital to return to a skilled nursing facility, to require 1 or 2 days in a row of a negative test. Some people never, in months or 6 weeks, don't even turn back to negative. I just read it wouldn't be a complete day without a small dose of science. And from yesterday, I read a really good published paper that looked at exactly this question, which is in somebody that is proven on a date to have COVID-19 through a positive PCR test of the nasopharynx, paired that with the blood test for the gamma globulin, the IgG in the blood, so we know they had it, they know they mounted an immune response. But those people would stretch out for days and weeks oftentimes, or even into a couple months, with remaining positive in the PCR test in the nose. And what we're learning about that is that it's genetic fragments, that it doesn't impart infectivity. It doesn't mean they have an infectious disease, doesn't mean they're shedders, and doesn't mean that they can impart the illness on somebody else. So I think that while I understand the intent, which is to make sure that nobody that has had the illness puts anybody else in harm's way, and I understand the intent to prevent that from happening, we need to find a better way to make sure we can kind of give the, quote, good housekeeping seal of approval, unquote, for people to return back to settings like that. I think it's very well documented that if it's 10 days after a person became ill, or as little as 3 or 4 days after their last febrile period of time, they're not likely to be at all infectious. But that nasal test is the very last thing to change. And if we don't take science to heart on this one, then people will be sidelined for a very long period of time, and probably needlessly.
Secretary Norman, at what point, how many more tests do we need to have in the state in order to do that community testing where we're able to just test everybody?
We'd like to do 60,000 a month, which is 2% of our population. And we're not there yet. One of the things we just discussed today, which is encouraging, is that our number of tests are going up, and the mixture of negatives and positives is improving all the time. So the rate of testing is going up, and the percentage of positives coming down. So number one, that's a positive sign. But we are targeting 60,000 tests a month.
Are the materials that we had ordered from a manufacturer, I think in China, and I think we were expecting a certain amount to come each week, have they in fact been arriving?
Yeah, we have many different supply chains that we've lubricated and paid money into, and those things are coming to us. I would characterize it by saying that anybody that's symptomatic, we can test, and in contact tracing around those symptomatic patients, we can test. So I'm always encouraging people now, our citizens, if you're ill, make sure you get checked out by a physician and get tested if it's in keeping with what this particular illness is.
Secretary, can you evaluate how things are going with the state, and what's the likelihood of us being in phase 2 by Monday, May 18th?
Sure. I don't know the answer to that, to where exactly we will be. What I can tell you, though, is that we've always talked about a 2-week increments for a couple of reasons. The main one is that that's the incubation period for the virus. So we are still, when you think about being, what are we now, about 10 days into this phase, we're still seeing the remnants of before we even came out of the stay-at-home original executive order. So we're always looking through the rearview mirror by about 2 weeks. So with every additional day, we get smarter. Again, as we talked about on Monday, 4 to 7 days is the incubation period, so we know a lot more than we did 3 or 4 days ago, but we'll have more complete knowledge even by the end of the week, because then we're going to be advancing that 2-week period into this phase that is truly the impact of what people are doing during this phase.
Governor, you will later this afternoon chair the State Finance Council. I'm sure you enjoy that. I am curious, is it your position that you can essentially reissue these disaster declarations again and again for this COVID-19 disaster if they are not extended, or if for whatever reason the council chose not to extend, would that essentially be the end of your emergency authority?
The State Finance Council needs to extend. I would not want to test that authority, and nor would I want them to take a pass on their responsibility.
Governor, I'm wondering what else can be done to help nursing homes. I'm talking to nursing homes, and they're telling me they just don't have enough protective gear. They're saving their protective gear. They're using cloth masks. Even if they have some on hand right now, maybe it's a week's supply or 2 weeks supply, they don't dare use it, not knowing how much protective gear they'll get later. I don't think this is ideal, talking to experts. And these are our most vulnerable people. What more can be done?
Celia, I can't address the specific nursing home situation, but I would hope that all of these nursing homes all across the state are working very closely with their local public health folks, who would then be working very closely with the state public health and emergency management folks, and let us know if there are some severe shortages going on there, and let us see what we can do to help.
Governor, if that emergency declaration, if that the council today decides not to extend that, what will that look like for the state moving forward? What would that, where would that leave people?
It will leave us in a really bad position. That extension will protect a number of the executive orders that we have put in place, which, for instance, the eviction and foreclosure, that would go away. And so we would be putting the citizens of Kansas in a really precarious position if we were not to extend, if the State Finance Council was not to extend that declaration.
Secretary Garcia, earlier you had spoken about submitting two separate temporary rules or regulations to the Attorney General. I'm curious, are those, is that just two versions of the same regulation that you're trying to get Schmidt's approval on, or can you just kind of explain
Yes.
what changed from the first version to the second version?
Thank you. You're asking what's the difference between the two regulations. So the first one did cover just first responders and healthcare workers. And then part two of his concerns were, one, this was needed to be done in the legislature, and two, did not approve of the retroactive going back to January. So we did go back and write a second regulation that addressed the retro, and so we did take that out actually. And then we added in the essential workers. As we just heard what happened, the corrections facility, that is a devastating reminder of why to include essential workers. And so that's the difference.
When did you offer that second version to him?
Let's see, I believe that was, all my days are blurred. So I think that was last Friday, Monday, so it was in, it went through budget yesterday or today, and it should be at the Attorney General's. And we also gave them an earlier version because it was quite similar, just adding, taking out the retro and putting in the essential workers. So we expect to hear back from the Attorney General's office, hopefully in the next 48 hours.
Secretary Garcia, we've been told people have been approved for unemployment benefits several weeks ago but have not received their first payment yet. Why is that, and what is the Department of Labor doing to resolve the situation?
Yes. So the question is why are some people not receiving their unemployment benefits? So part of that is, again, if everyone, a huge piece of it is if everyone's rushing to do on Sunday and all day Sunday and sometimes Monday. The important thing is, one of the things we've been sharing is the gating system, to use your last name, the first letter of your last name, to do it so that way it doesn't get bounced back. And what the gating system, again, is on Sunday and Tuesday and Thursday, individuals from A, last name, A as in apple, M as in mother, and then on Monday and Wednesday and Friday as well would be the remaining letters, N as in Nancy and Z to zebra, and then Saturday, anybody who would catch up. Another second part of that has been the result of the bank cap that I just shared with you. Our bank was not used to paying this much money out in one day, so we're doing unemployment benefits, then we're doing the FPUP, which is the $600 each day, and then the backed up pays of the $600 was from the past 3 to 4 weeks. So our bank was not used to that. So the good news is we found that problem, addressed it, and so we're working with the bank as we speak to lift that cap to a higher amount, doubling it so that we don't have to run into that problem again.
One more question?
How long can you continue payments at this level before the trust fund starts to be, I guess, get to a concerning level?
Yes, so the good news is we actually are in a good position with our trust fund. And again, that's thanks to partnership from the legislature and business leaders and other stakeholders who put this work in before. And so at the beginning of this, I shared, we went into this at about $1 billion. We are at about 956 million right now. So we have other states in worse positions than us. And so we will have the funds. We also know that states will already be running out in the next probably 3 to 4 weeks. So we do expect, again, the federal government possibly passing a fourth bill in the coming weeks or months. And should that happen, again, there might be other actions with that. And another reason why we will ask for the flexibility to be able to, if the federal government does pass a law in the time that the legislature is not in session, we're going to need to have that flexibility.
Does the federal government have any control or say over the trust fund dollars? Do they have any access to that?
Well, it's our own trust fund, yes. Thank you.
Thank you.